In today's lecture, we'll be talking about the biochemistry of cerebrospinal fluid, or CSF. These are the learning objectives. So we'll first talk about what is the definition of CSF and what is it for. And then we'll talk about how it's formed and how it's produced, how does it circulate in the central nervous system, and what is the normal composition of CSF, and how exactly do we assess CSF, whether it is macroscopically, biochemically, or cytologically. So by definition, cerebrospinal fluid is a fluid. It's a very special kind of fluid because you can only find it in the nervous system, and it is the product or an ultrafiltrate of plasma. So it's a product of plasma that has been filtrated in a certain way. And you can only find it in the brain ventricles. So the ventricles in your brain, and also in the subarachnoid spaces that can be found inside the cranium and also the spinal cord. So it's a very specific type of fluid that is only found in the nervous system. And it's important because it has a lot of functions. Firstly, it provides protection. So it's a shock absorber that can help protect the nervous system from impact. And then the second function would be to provide nutrition. So it's a way of providing nutrients and glucose and all sorts of other things to the brain. And also in another way, it also acts as a waste removal for any toxins that could be present in the brain. So how is it produced and who produces? What structure produces CSF? So most of the CSF is produced by a special type of cell. So it's a cuboidal cell network called the choroid plexus. And you can find this cell network inside ventricles. It lines and it's continuous with the ependymal cells that are inside your brain ventricles. And these cuboidal choroid plexus networks surrounds all the capillaries that are going to be used for plasma filtration inside your brain. And this, as you can see, between one cell and another cell, there is a very, very tight space. So it's called the choroidal plexus tight junction that forms a very important barrier called the blood CSF barrier. Now, the barrier is very important. So the CSF barrier, the blood CSF barrier, is important because it's the regulator of what can pass into the brain. As you know, we can't just let everything pass into the brain. That is very dangerous and can create a lot of damage. So what we need the barrier to do is to regulate and to maintain a certain composition of cerebrospinal fluid and to maintain this composition of brain environment. And for that, several substances such as cells, proteins, and glucose cannot pass through the brain in an easy manner. They need active transport. So you can rarely find these inside the brain unless they are actively transported. And then small molecules like nutrients and ions tend to pass relatively easier. There's also the ion electric gradients that facilitates this, whilst water can pass through epithelial aquaporin channels, special channels that can allow the passage of water in and out of the brain. Now, once the CSF has been produced by ventricles, so as you know, we have several different ventricles in the brain. We have the fourth ventricle, the third ventricle, and the lateral ventricle. And once this has been, the choroid plexus inside these ventricles have produced the fluid, what happens is then it will flow. Now, the flow is also regulated. So what happens is that the ventricles, especially the lateral ventricles, because this is the main producer of CSF, this will allow the flow of CSF into the cerebellomedullary system through what we know as the Magendian-Luschka voraments. And then this will flow down into the medulla and the spinal cord subarachnoid spaces, and then rostrally. So rostrally means back into the superior and lateral cerebral hemisphere through what we know as the pontine cistern, the ambient cistern, and the interpendicular cistern. So it goes through these cisterns into the cerebral hemispheres. And once it's in the hemisphere, it can then undergo passive diffusion into the venous sinuses through what we know as these little arachnoid villi. Now, Because the CSF is highly regulated, we expect that it's at a certain composition at all times. In this table, you can see what the normal composition and normal characteristics of CSF is. So as you can see, the normal color should be clear or colorless. There should be a specific gravity of 1.006 to 1.007 with a pH of 7.4. When you first take a sample of the CSF, the opening pressure should be around 50 to 200 millimeters of water. There should be no red blood cells in the CSF normally. There should only be a very low amount of white blood cells, around 0 to 5. And the type of white blood cells should be mainly lymphocytes. There's allowed to be proteins in the CSF, but at a level of 15 to 40 milligrams per deciliter. Lactate is at a level of 1 to 3 millimoles per liter, and glucose is at a level of 50 to 80 milligrams per deciliter. And there should be no microorganisms, no bacteria inside the CSF fluid. Now, this strictly regulated composition allows us to diagnose diseases, because if there are violations or differences or variations in CSF composition, then we can suspect that there is something wrong with the patient. Now, what can be wrong there? It could be a lot of things. It could an abnormality of the CSF can indicate that there's an infection. So there's a pathogen invading the central nervous system, or there could be inflammation. There could be bleeding or hemorrhage, and there could be malignancies or tumors. Now, in order to be able to analyze the CSF, of course, we need to obtain a sample. And how do we obtain a sample? It's through this procedure called lumbar puncture. Lumbar is the lumbar spine, and puncture means we stick a needle into this space, the subarachnoid space inside in the spine. And then what happens is that we can obtain a sample of cerebrospinal fluid, which we can then assess macroscopically, biochemically, and cytologically. So how do we analyze CSF? Once again, there are three approaches. First is macroscopic, second is biochemical, and third is cytologic. Macroscopic means we look at the sample with our naked eye, just with our eyes, and look at whether or not it's normal or pathologic. So when we look at a CSF sample with our naked eye, we evaluate the color and the turbidity. So we know that it should be clear and it should be colorless. So the color should be colorless and the turbidity should be clear. But if it's cloudy, then we can perhaps suspect that there are leukocytes or erythrocytes, so a lot of cells inside the fluid. However, and if it's blood stained, so if it looks like it has blood in it, or it's another term for that is erythrochromic or sanguinolent, then there's several reasons that could happen here. Could be that the patient had a traumatic lumbar puncture, so maybe we punctured an artery when we inserted our needle, or it could be due to an intracranial bleeding inside a patient's central nervous system. If it's xanthochronic or yellowish, like in this picture, then maybe that indicates either the presence of bilirubin or maybe all the bleeding inside the nervous system. So that's macroscopic examination. You can only evaluate the color and the turbidity. With biochemical examinations, there are more options that you can explore. First of all, we can measure the protein. So when you compare the cerebrospinal fluid with plasma or serum, it should contain 200 times less than plasma in terms of protein content. And when there's increased protein, we call that hyperproteinuria. Okay, that means increased protein inside the CSF. And this can indicate a lot of things, but it could mainly tell you that there might be an impaired or broken blood CSF barrier. There could be immunoglobulin or maybe tumor infiltration in the nervous system. There's many causes of elevation clinically. It could be meningitis or inflammation of the meninx, and it could due to bacterial or viral infection. It could be because of subarachnoid hemorrhage or bleeding, and it could be vasculitis or neoplasms. Electrolytes can also be measured, although this has less clinical utility compared to the other parameters. The next one is glucose. So Glucose, as we know from previous lectures, it's the main energy source in the nervous system. However, even though it's the biggest source of energy, it is still tightly and strictly regulated. There's a special transporter, glucose transporter, that is responsible for the uptake of glucose into the brain. And when there is glucose in the CSF, we call that glycorrhea. And the concentration of glucose in the CSF highly depends on the concentration in the plasma. So when we evaluate whether or not the glucose content in the CSF is normal or not, we need to first know what is the content in plasma. So what we do is, to find out whether or not it's normal, we can also obtain the ratio of glucose CSF to plasma. So glucose CSF divided by plasma CSF should be around 0.6. Now, low glucose can indicate infection by bacteria, so bacterial meningitis, because bacteria theoretically consumes a lot of glucose, therefore creating low glucose in the sample. Could be seen as tumors, or it could be ischemia, while high glucose levels can indicate that the patient might be diabetic. Another metabolite that we're interested in when we perform CSF analysis is lactate. Lactate originates from glucose breakdown, but it is done or produced in anaerobic conditions, so no oxygen. The importance of lactate detection is for distinguishing viral or bacterial meningitis, because if it's elevated, usually that means the patient might have bacterial meningitis. It can also indicate disorders of blood supply, because it is produced under anaerobic conditions. Any conditions that can, any diseases or pathologies that can create this condition might result in increased lactate, and this could include stroke or hypoxia. It can also be elevated in subarachnoid bleeding. Now, the last analysis approach is cytological, meaning that we look at cells. So what cells can we find in the CSF? And there are two ways to do this. First, you can count the cells, and that is called quantitative. Quantitative means you count it, how many cells is there. And the second approach is qualitative. So we don't just count it, but we look at the type of cell, the differentiation or the differences. What different cells can we find inside the sample? And the normal composition usually is that a CSF, if it does have cells, is mainly composed of lymphocytes relative to monocytes. And if we can find a red blood cell, then that we should also suspect that a patient might have an injury or bleeding in the liquid pathway. Could be the production pathway, or it could be in the circulation pathway. The presence of other cells can also indicate many different pathologies. So cell analysis is very important. And then we have quantitative analysis, where we not only look at the type, but we also count how many cells are there. Normal number of cells. So if the patient has a normal amount of cell, then we call that oligocytosis. And if it's elevated or too high, then we call it pleocytosis. Okay, now, although we have seen the basic assessment of CSF, what I would like to maybe just talk about a little here is that the future prospect of CSF is actually very promising, because now with molecular biochemical tests, we can also test a lot of different biomarkers for specific diseases, not just to detect the disease, but to monitor if the disease is progressing or getting worse. An example of this would be the testing of tau protein and beta amyloid protein for patients with Alzheimer's disease, or maybe the vascular endothelial growth factors for CNS malignancies, so malignancies of the central nervous system, or maybe markers of sleep disorders like hypocretin. There are also talks of markers that can indicate acute neuronal degeneration like neurofilaments. So there's a lot of potential prospect of biomarker testing in CSFs. In conclusion, CSF is very important for maintaining normal neurological function, and because of its importance, then it is very strictly regulated. So if there is any abnormal variation in CSF, then we can use that information to detect or to suspect the presence of a pathology. Is it an infection, inflammation, or maybe malignancy or trauma? And analysis of CSF the basic analysis I mean here is through 3 approaches: microscopic, biochemical, and cytological assessment. And future testing can also target disease-specific markers. These are the references that you can read if you want to find out more about the topic. Thank you for your attention.